Well, thanks, Mr. Chair, and thanks for holding this hearing, and thank you to our witnesses, not only for being before the committee today, but for the work you do to protect patient privacy and safety. We really appreciate it. Ms. Pierce, I want to start with a couple of questions for you that really follow up on what Senator Peters was asking about with a focus on rural hospitals. I am really concerned as someone from a small state, your next door neighbor, New Hampshire, about cybersecurity threats to rural or smaller healthcare providers. In 2021, a ransomware attack targeted a small health service in Berlin, New Hampshire, forcing the provider to shut down some of its clinics for several days. Based on your experience as a cybersecurity professional, what are the most significant cybersecurity challenges facing rural and smaller healthcare providers?
I think thank you for that question, Senator. I believe that some of the biggest issues that these organizations faced is the fact that nearly all the staff in a critical access hospital or a small facility wear many hats. They don't specifically focus on cybersecurity, and with the competing priorities that we're now seeing in healthcare, it's very difficult to focus on something that is not required. If I had 10 things to do today, and I knew that 2 of them were mandated and required for me to do, those are the things that I'll focus on. So as we continue to provide guidance and recommendation from the federal government, we haven't seen any minimum standards or requirements from the government, which would take us to the point where those would become imperative for facilities to implement. So I would urge us to go in that direction, but don't do that without supporting us in achieving those standards.
Right, because one of the differences I think you're really referencing is a larger, more metropolitan hospital might have the capacity to have an administrative staff where somebody with the expertise and focus can really devote themselves to cyber. And in our smaller places, even when they're fully staffed on the patient care side, the administrative staffing tends to be very, very sparse.
I agree.
There are a number of resources and tools available for healthcare entities to improve their cybersecurity, such as the best practice guidance that Mr. Garcia described today in his testimony. But as we've just discussed, rural hospitals are under-resourced, understaffed. You got at this a little bit with Senator Peters. Ms. Pierce, you were talking about the need to make sure funding is really reimbursing costs. But what specifically can the federal government do to ensure that small and rural healthcare providers are both aware of and have the ability to utilize existing resources and tools for cybersecurity?
I think the first step that we need to take is to move from guidance and recommendations to minimum standards. Okay. Once we do that, I believe that those recommendations and guidance will be very helpful in moving that sector to secure their environments. Currently, I've worked with a lot of small hospitals, being with Fortified, hospitals across the country, and invariably they are at a state where there is absolutely no security program to it's very minimal. We asked all of our healthcare organizations to perform risk assessments when we implemented the HITECH Act. So everyone is now aware of where their risks are, but they're choosing to accept those risks in lieu for mostly for financial reasons where they can't afford or can't staff their personnel to address those risks.
So your thinking is that some baseline standards and requirements would kind of drive hospitals to work with the federal government and others to find out the resources they need and then to actually prioritize that. That fair?
That's fair. Also, don't forget, we need to also provide them the ability to actually implement their security measures.
Fair enough. Okay. A question for you, Mr. Garcia. The Health Information Sharing and Analysis Center, or the Health ISAC, is a valuable forum where healthcare partners can share vital cybersecurity information, such as intelligence about current and future threats or best practices for addressing those threats. However, as we just heard, smaller healthcare entities are already under-resourced and understaffed. In your experience, do rural and smaller healthcare entities have adequate access to the Health ISAC?
The Health ISAC does provide a lot of free resources to the public at large. I think, as Ms. Pierce expressed, however, there's a lot of information out there, and trying to sift through it in ways that would be relevant and actionable to your particular instance is difficult. Many hospital systems around the country rely also on regional clusters, information sharing and analysis organizations, peer organizations within a region where there's a trust relationship. So there's a lot of options for how you gather your information. At this point, the Health ISAC is populated by a lot of very well-resourced organizations that do have sophisticated information security professionals who are really tracking this on a 24/7 basis. So the priority is for every organization to consider what kind of information are you able to actually take in and then take action on.
So are there incentives that we could use to help smaller rural hospitals really access the Health ISAC, or are there barriers that they have to membership in it right now? How can we help them become more integrated into the Health ISAC?
Well, my feeling is it is a small investment. It's an investment into collective defense, but absolutely. I mean, I think that some kind of subsidies or financial support for smaller systems to get involved either in the Health ISAC or other information sharing organizations, if it's a cost matching subsidy that would help them into this kind of a community, I think would be tremendously beneficial. Small hospitals have to make all kinds of existential financial decisions about resource prioritization. So to help them get into a collective organization where you have this communal situational awareness, I think is a good first step. You can't protect against what you don't see.
Thank you, Mr. Chair.